Okay, so we will get started. Hello, welcome this evening to everyone for our first cardiac webinar for the month. So this month is our cardiac month. So this is our first webinar of this series, The Chamber of Secrets, Unlocking the Cardiovascular Labyrinth. So all about heart anatomy and how blood flows through the heart. Now, very excited tonight because we are making this one Harry Potter themed. I'm the kind of person I learn best with things like analogies and mnemonic devices. So Harry Potter is one of my absolute favorites. Seems like a really good opportunity to use that in a webinar, right? So hopefully we've got a few Potterheads out there that can keep up and work our way through as we unlock the different chambers of the heart, solve our mission, see what our reward is at the end. So before we get started, Veterinary Nurse Solutions acknowledges the Aboriginal and Torres Strait Islander people as the first inhabitants of this land. We recognise the rich cultural heritage and deep spiritual connection to the land and waters, and that their sovereignty was never surrendered. We pay respect to the ancestors and elders who've safeguarded the diverse wildlife and habitats of this beautiful country throughout the generations, and will continue to do so for generations to come. So just a little bit about me, in case you haven't met me before. My name's Cherie Murdoch. I'm one of the educators here with ACVN. I'm a Cert 4 registered veterinary nurse. I've had 12 years experience in the veterinary industry, so mainly in general practice, but have thrown my hand in a little bit of specialty surgery and emergency and critical care. Currently a head nurse at a busy general practice here in South Australia. I completed my Certificate 3 and Certificate 4 with ACVN. So for our ACVN students that we have with us, I can absolutely understand your pain if you're currently doing the anatomy and physiology subject, because it is definitely a tricky one. And this is hopefully a really good resource to help you sort of learn that anatomy, particularly of the heart there. Just a little bit of extra information about me. In my spare time, a neonatal kitten foster carer, and I do own a geriatric border collie and a rescue kitty. So the outline for this evening, we're going to be identifying the structures of the heart, explain the sequence of blood flow through the heart from deoxygenated to oxygenated, defining the roles of heart valves and predict potential complications if these structures fail. Now, it sounds pretty boring when we put it like that, but that's why we want to make this one a little bit themed up a little bit. So we're going to have some riddles to solve, some missions that we need to do. So I'm going to get your help a little bit to unlock the different chambers of the heart. And as I said, Harry Potter style, just to keep it really good. In fact, I've got my Don't Let the Muggles Get You Down singlet on just to keep us really on theme tonight. So first things first, let's look at the actual physical anatomy of the heart. As I said, big fan of things like analogies. So a really good way to do this when we're looking at the heart as a structure itself is similar to a nut, an acorn to be specific. So looking at the image that you can see here, the heart is split into left and right sides, and it's split by the septum that goes right down the middle there. We then have the atria or atrium at the top. So that's kind of like the acorn cap of an acorn sitting up there. And again, split into left and right. You'll notice with the atrium, they're quite a lot smaller than the ventricles below. They're thin-walled as well. We'll talk a little bit about why as we get on, but mainly to do with the pressure of blood flow coming through to the atrium. So if you just remember those smaller structures are going to be the atrium at the top of the heart. And then separating the atrium to the ventricles, we have valves. So different names that we'll go through in a little bit as well, but we have one-way valves separating the atrium to the ventricles. And then finally, those ventricles down the bottom there. Now, these ones are really thick-walled, so they can withstand quite high pressure and volume of blood that's going through the heart. Just a little bit of extra, I guess, facts or information when we're looking at the anatomy of the heart as well is the heart does have particular cells within the walls of the heart. We call those cardiomyocytes. Most of those are also known as pacemaker cells. So you might sort of have heard that term before. And these are within all chambers of the heart. Now, the role of cardiomyocytes, they are specific cardiac muscle cells, and they're really responsible for the contraction and pumping of blood through the heart. In terms of what they look like, they're quite striated if you were to look at them physically, and they're interconnected by intercalculated discs. sort of fancy words that we're using. But essentially, within all 4 chambers of the heart there, what we do find is that within the ventricles themselves, within the ventricles, the ventricular myocytes are quite larger and more robust, again, because we've got more pressure of blood going through the ventricles. So we need a lot more robust cells there. Also, within all of the cells of the heart, we do have endothelial cells. Now, these line the inner walls of the heart. Almost think similar to how we pave roads. We pave roads to make them a lot smoother as blood goes through, to avoid turbulence and disturbance. These are the same with these endothelial cells. Okay, let's see if we can get into our first chamber of the heart. Now, just like the beginning of every Harry Potter movie, we have the sorting hat that's here to give us a little bit of a vibe, a bit of a riddle. Sometimes he gives us a question we need to solve. Sometimes he's setting the theme of the story or the movie. And our anatomy webinar is no different. So let's see what the sorting hat has to say. Fresh blood, deoxygenated or oxygenated? How will I decide where it will flow? To which side do I guide? Right chamber, left chamber, sorted with care. Each drop is the key for its own destiny. Nice and cryptic. Thank you, sorting hat. So the question that we're looking at here is what sort of blood is first going through to the heart? Now, just a quick fact or piece of information, when we're looking at an anatomical picture of the heart, like you can see on your screens here, it's reversed. And this is the same in pretty much every anatomical image that you'll see, whether it be the heart, whether it be muscles, different types of anatomy, bone structures, they're always reversed as if we were looking at that. Imagine you had a cadaver in front of you. We've opened its chest cavity. This is how the heart would look. So when we're talking about the right side, the right atrium or the right ventricle, it's going to be left on your screen, but that's because it's reversed. If it was within our own body, obviously it would be our own left or right there. So first looking at how blood is received through the heart. You can see the different colours here. We've got blue and we've got red. Anyone have an idea of which one would mean? Pop it in the chat box or feel free to say it out loud. What would say blue mean? Oxygenated or deoxygenated?
Deoxygenated going into the left atrium.
Perfect. Exactly. So, yep, that's exactly right. We've got our blue is deoxygenated. Now, the blood comes from the largest vein within the body, which is the vena cava. So that's this one that we can see isolated here. Now, it comes from 2 areas of the body. So from the top of the body and the bottom of the body. Now, in veterinary terminology and anatomy, we always use things like cranial and caudal, and this is no different here. So we have the cranial vena cava, also known as the superior vena cava. So way to remember that is you think superior, higher up, it's higher towards the head. So the cranial vena cava, this is receiving blood from the top of the body. So think the head, the neck, the forelimbs in an animal, that sort of thing. We have the caudal vena cava, which is also known as the inferior vena cava. So remember again, inferior, think lower, subordinate, going towards the end of the body. So the caudal vena cava is receiving blood from things like the pelvic region, the hind limbs, even like abdominal viscera, that sort of thing. Don't need to get worried too much about, the different ways that it's receiving blood from. I guess if you think about it, I like to use the analogy of a road. So you know how you might have a road that's like Davy Road South or Davy Road North. Either way, it's still the same road. So if we just think about the blood's coming from either side there to the heart is the most important thing. So once we're receiving our deoxygenated blood via the vena cava, it is then going into the right atrium. So on our image here, it's going to be looking at the left, but it's on the right side of the body. So within our right atrium, once this then fills full of blood, we have the tricuspid valve that is separating the right atrium to that right ventricle. When the ventricle relaxes, the tricuspid valve opens and blood goes through to that right ventricle. We're then moving blood through to the pulmonary valve, into the pulmonary artery, out to the lungs. So this is now where blood is going to go and get oxygenated. Oxygenated via the pulmonary capillaries within the lungs. Once we're getting our oxygenated blood coming back through the heart, it's entering... Sorry, my computer is now freezing on me. Please don't do that. So our reoxygenated blood is coming in via the pulmonary vein. So always try and remember as well with your atrium and your ventricles. Atrium, because they're those thin-walled, they can't withstand a lot of pressure, they only receive blood from the veins, whereas the ventricles are always receiving blood from, returning blood via arteries because they can handle that higher pressure. So that's another good sort of point to remember. So we have our oxygenated blood coming back from the lungs via the pulmonary vein into the left atrium. We have the mitral valve separating that left atrium to the left ventricle. Once our left ventricle relaxes, the mitral valve opens, filling up that left ventricle there, where we then go through the aortic valve to the aorta, pumping blood to the rest of the body. That was a very, very quick rundown, very quick flow through. Don't worry, we're going to go through it in a lot more detail now. Just wanted to give you a bit of an idea of how that blood moves through. Another good idea is to think almost moving in a clockwise motion from us looking at it anatomically. So let's see if we can unlock our first chamber. We're wanting to get into our first chamber of the heart. We've got to solve our first riddle. So our first question is, in which order does blood move through these structures? So what structure is first receiving our deoxygenated blood? Remember, that's coming from the body. It's already had oxygen taken away and used for fuel. So deoxygenated blood is coming through to the heart. How is it being received? Which structure? Maria said vena cava, absolutely. So our vena cava there, perfect. What about once we've received our deoxygenated blood via the vena cava, where does it go next? The right atrium or the tricuspid valve? Right atrium, spot on. So we go to our right atrium, and once our right atrium fills up, our tricuspid valve opens, unlocking our chamber to our next area. We've got our nifty little key there. It's going to unlock our chest for us, and we can see how that blood is moving through. So a little bit of information on the tricuspid valve now. So that valve separating the right atrium to the right ventricle. It's a one-way valve. So you can see sort of in the visual of how that is created. The reason is to stop that backflow of blood or that prolapse. You know, what we want is to make sure that blood is flowing in that one-way motion from the atrium into the tricuspid valve. We don't want that going back through. The tricuspid valve, it has the name specifically because it has three cusps or leaflets that are supported by the technical term for it is chordae tendineae, but essentially like they're tough fibrous strings that stop those flaps prolapsing or going back and allowing that backflow of blood there. So that valve is that gateway into that next chamber. Beautiful. We've moved into our chamber now. We're in our first chamber in the right atrium. So let's go through some information of the right atrium. What is its point? What is its structure? And what are maybe some of the complications we see within this area? So this is the first chamber or area that receives deoxygenated blood from the vena cava, the largest vein within the body. As we've said, it is quite thin-walled. Being an atrium, it can't stand large amounts of pressure of blood. Now, with the right atrium, the other things that we see in here is our pacemaker cells or those cardiomyocytes. So the sinoatrial node, for example, is specifically located within the right atrium. This role is to generate electrical impulse. So basically that sets the heart's natural rhythm. We also have atrioventricular node cells, and this is actually located between the atrium and the ventricle. What they do is essentially slow down the impulse, so to allow for proper timing of contraction. The contraction's also going to be enabling the valves opening in a certain order, which we'll talk about a little bit later to make sure that we don't have that blood back flowing through. Now, in terms of, I guess, common abnormalities, diseases, signs that we would see specifically within the right atrium, the biggest one would be our tricuspid valve dysfunction. So keeping in mind, we want that valve to have that one-way flow, only allowing blood to go to the right ventricle, not backflow through. If that does happen, so if we have almost this sort of leaky or prolapsing valve, that is where we'll see a sort of a right-sided heart murmur. So for anyone that's had a listen to a heart murmur on a stethoscope and you hear that kind of whooshing sound rather than that nice sort of strong heartbeat, we get almost this kind of whooshing muffled heartbeat. That's because we have a backflow of blood going from the ventricle back into the atrium there. Other things that we might see are things like right atrial enlargement, so that area to actually be enlarged. We can actually see that on an ECG. So when you're looking at your ECG reading, your trace, your PQRST trace, what you'll actually notice is things like the P wave is really quite tall and peaked. So that might be a sign that we're having an abnormality there within the right atrium. In terms of symptoms or clinical signs that we'll see will be things like, particularly for a heart murmur, that's when we have ascites, so we might have fluid accumulation within the abdomen. We can actually also see jugular vein distension with those right-sided murmurs. We also have pulmonary hypertension, so that high blood pressure that's coming through that right atrium, which we know the atrium can't withstand very well, and even chronic respiratory disease. Another thing that we can see as well is right atrial thrombus. So this is usually associated with sort of conditions like atrial fibrillation. But essentially that is our right atrium in a nutshell there. So just to recap there for our deoxygenated blood, we're going from the vena cava, remember we have our superior and inferior vena cava, moving into our right atrium, and then we're holding at that tricuspid valve ready to move through. So that tricuspid valve is that gateway to our next chamber. So of course, we're going to have to solve another riddle before we can get through to that next gateway. So let's see what the sorting hat's going to present for us now. But how do we pass through the tricuspid valve? Do we push? Do we wait? Do we bang on the gate? To pass through, you need to answer the riddle. On the right, I help blood flow with ease. My name hints at numbers of 3. To pass on through, what is the answer meant to be? How many cusps make up me? So how many cusps within the tricuspid valve? The name kind of gives it away. 3, absolutely. So that's correct. We have 3. The tricuspid valve has 3 cusps or leaflets. So that's what is our gateway there into our second chamber, being that right ventricle. As we mentioned, if we do have any broken leaflets there or broken cusps, that's when we get that blood back flowing through and we're seeing those signs of a heart murmur. And it's particularly here on the right-hand side as well that we're more likely to see blood flowing back through, putting more pressure then on the vena cava, which then puts more pressure on the other organs within the body. What we then have from there is when fluid essentially leaks out of the veins within the body, and then we get that fluid accumulation in that abdominal cavity known as ascites. So if you've ever had to do like an abdominal centesis on an animal in heart failure, that's exactly why. All right, can we get through to our second chamber? Oh, not just yet. We've got to solve some more riddles first. So a couple of more little fun questions for us. What is the name of the next chamber that the blood moves into? So after the right atrium, where are we going next? So looking at the numbers that we've got on the screen, or sorry, the letters rather that we have on the screen, left atrium, left ventricle, or septum. Got 1 for right. Right ventricle, yep. 2 for right ventricle, yep. Beautiful. Revelio, what's Harry going to give us? Absolutely. The blood is now moving through to the right ventricle. Are we in the second chamber yet? No, we've got some more questions that we have to answer first. So does the right ventricle pump oxygenated or deoxygenated blood? Remembering where our blood is coming from. What do we think? Oxygenated, deoxygenated, a combination of both, or wait, what? It pumps blood? Got 1 for B, 1 for oxygenated. Last few seconds to get your ideas in. Quite a few for B. What have we got? What does Harry say? Revelio. It is B. That's right. We're still pumping our deoxygenated blood. We haven't left the heart yet. So making sure that we do still have our deoxygenated blood coming through from that right side of the heart. So what is the main function of that right ventricle? Now, you might not know the answer to this one yet because we haven't covered this in a bit of detail. So remember, we've received our deoxygenated blood from the body. So what's the purpose here? Are we going to pump blood to the lungs for oxygenation? Are we going to pump oxygenated blood to the rest of the body? Do we collect blood returning from the lungs, or are we regulating heart rhythm? Bit of a tricky one here. Couple for A. Another one for A, yep. Last few seconds to get your answers in. Let's see what Harry has to say. It's A. Well done. So that's right. We're pumping blood to the lungs for oxygenation. We haven't left the heart yet. We've still got deoxygenated blood. We have to go diffuse over the pulmonary capillaries to get our oxygenated blood. Final question. Let's see if we get this one into our second chamber. So what valve connects the right ventricle to the pulmonary artery? Is it the tricuspid valve, the pulmonary valve, the mitral valve, or the aortic valve? Now, again, we haven't gone through these in a lot of detail, so absolutely fine if you don't know the answer. Got one for pulmonary. Any other answers? Let's see what Harry has to say. Revelio and B, that's right, pulmonary valve within the name, easiest way to remember. If you kind of think about your pulmonary veins, your pulmonary arteries, they're going to be what is the blood that's leaving the body and also the blood that coming into the body, into the body from the lungs. So good little tip to remember there. Yes, look at that. We're in our second chamber now. We're in the right ventricle. How good. So a little bit of a rundown of what we see within this right ventricle. So we're pumping our deoxygenated blood now to the lungs. That's the key function of the right ventricle there. It does have thinner walls than the left ventricle because it does have lower pulmonary pressure than the left-hand side, but still thicker than the atrium because, again, we've still got to withstand that thicker sort of blood pressure there. We do have particular type of fibers or cells within that right ventricle, and they're the Purkinje fibers. Very particular name there, Purkinje fibers. And essentially their role is they're a conducting fiber. So what they do is really quickly transmit impulses to ensure rapid and synchronized ventricular contraction. So enabling that ventricle to contract, which is then going to open our pulmonary valve, pushing the blood out. Now, in terms of, I guess, diseases or clinical signs that we'll see isolated to the right ventricle, we have pulmonary hypertension. So again, that higher pressure there. The signs that we might see of things like pulmonary hypertension are exercise intolerance. So those dogs, or mainly dogs, we can see it in cats as well, but that are really starting to struggle on walks and their exercises. Syncope or fainting episodes is isolated as well with the right ventricle, and cyanosis, so not receiving enough oxygen to the tissues there, which we can obviously see with colour of mucous membranes. This essentially leads to right-sided heart failure. Another way to think about, I guess, the diseases associated with the heart is that the heart is a muscle. So, when we go to the gym and we're trying to work on our muscles, we're doing all our bicep curls because we're trying to get really big biceps. That's a good thing. That's hypertrophy, right? Because we're wanting to really stretch the fiber of the muscles, make those bigger. And that's a healthy thing. With the heart, not so much. So when the heart is under pressure or working harder, being a muscle, that's when we're going to have potentially hypertrophy, thickening of certain walls. And that could actually then affect things like pressure through the heart. That could affect how we have blood flowing through the heart, how our valves are functioning. Could cause any stretching or tearing of the valves there as well. So we're not actually wanting to work our heart like a muscle. We've got to actually be taking off the workload when we're starting to see our heart struggle there. Another sign that we do see with the right ventricle as well is parasites. So heartworm is potentially basically isolated within that right ventricle as well. So when we see parasites, like heartworm, they do lodge within the pulmonary arteries and the right ventricle. And again, similar signs to what we might see with, say, pulmonary hypertension in terms of your exercise intolerance, your coughing, lethargy, ascites. So always really good when we're having those questions with clients, when they're starting to notice those signs, are they up to date with parasite prevention? Even though heartworm has such low prevalence, particularly in Australia, still a really important question to ask. So just to recap, the path of deoxygenated blood and how that moves through. Come on, mouse, move over here. So firstly, we're receiving blood from the body, our deoxygenated blood from the body via the superior and inferior vena cava. It is then moving through the vena cava to the right atrium. It's holding at the right atrium at our little gateway, our tricuspid valve there, before moving into the right ventricle. We then go to our next gateway, being that pulmonary valve. So when our ventricle contracts, our pulmonary valve opens, our blood can then move through the pulmonary artery, where it's then going to go to the lungs for oxygenation. So let's see if we can unlock our third chamber now. We're halfway through. Sorting Hat's got another riddle for us. It's the place where blood gets a fresh, bright start, filling with oxygen to send to the heart. What is it? So where are we now going to be getting our oxygenated blood from that's coming back from the heart? Alveoli lungs, yeah. Any other ideas? Any other last chance to get some answers in? That's right. It is the lungs, exactly. So once the blood leaves the heart, it goes to the lungs via the pulmonary capillaries. This is where essentially our gas exchange happens. So we have our red blood cells that exchange gases. They drop off their carbon dioxide, which is going to be exhaled. They then pick up oxygen that has been freshly inhaled, and then returning to the heart there. So we now have our oxygenated bright red blood coming from the lungs. Now, the question is, in what structure are we receiving this oxygenated blood? What does Sorting Hat have to say? I'm a vein that's special, a bit of a twist. I carry bright blood. How rare is this? What vessel is it? So remember, we've only got veins that are receiving blood to the atrium. So what is the name of the vein that the left atrium receives blood from? Think about how blood left the heart as well. Got a couple in there, yep. Any other ideas? It's the pulmonary vein, absolutely. So our pulmonary vein is where we are receiving our oxygenated blood. Oxygenated blood, fresh and bright from the lungs, you come full of oxygen and fight. Which chamber is yours, steady and strong? Where should you go? Where do you belong? So we've received our oxygenated blood via the pulmonary vein. Where's it going now? Got our Sorting Hat keeping us on our toes today. Couple of different answers there, yeah. So what does Sorting Hat have to say? Who knows? I do, but unlocking this chamber is up to you. Not sure. Answers too few. Don't be glum. The blood is the key to the left atrium. That's right. So the left atrium, we're receiving that blood via the pulmonary vein. We are now within our left atrium. So similar in terms of the right atrium, except reversed for oxygenation. So we're obviously receiving our oxygenated blood from the lungs, still thin-walled, just like the right atrium was, because we can only receive blood via a vein. We can't have that high level of pressure. We do still have our atrioventricular nodes within this particular area. So it's another specialized bundle of electricity producing cells that's located. It's basically in the septum between the two atrium, really. The role, I guess, of that AV node is to essentially circuit break. So what it's doing is it's holding the transmission of electrical impulse from the SA node. So the ventricles contract slightly after the atrium. So that supports, I guess, maximum filling of blood within that chamber, and it maintains that forward flow of blood via circulation. So key little facts there that we see within our left atrium. The valve separating the left atrium to the left ventricle is our mitral valve. You might have heard of things like mitral valve disease before. So this is a disease specifically obviously located to this area. So again, we can have a murmur on this side when our mitral valve is allowing a backflow of blood. But interestingly, you will hear the murmur almost at the apex of the heart. So where we've got that purple little arrow, that's where we're actually hearing the murmur on that left side. So it's often referred to as like a left-sided murmur with mitral valve disease. Similar symptoms in terms of we see coughing, exercise intolerant, and even pulmonary edema, so getting fluid sort of within the lungs there as well. Knowing that our heart is a muscle, we can see left atrial enlargement if it is having to work too hard. We do see this on an ECG. This time the P wave is quite broad, so you see quite a broad P wave, quite notched as well. And we'll also see things like atrial fibrillation. So this is essentially like an irregular rhythm or arrhythmia that we'll see noted. So Lisa's asked, when you listen to the heart, can you hear the difference of, I think, left and right she's got there? You should be listening to essentially try and listen to the four chambers of the heart where possible when you're doing your thoracic auscultation to make sure they should all be sounding in sync. It's more like a nice, healthy sounding heart, same as, when we're normally doing an auscultation, we know what normal is. You're more listening for any abnormalities. So that's where you might hear more muffled or whooshing on one particular area versus another. And that's when you can then determine a right or left-sided arrhythmia. Okay, we're now going to be unlocking our final chamber, and we've got a pretty intense looking mission here. So anyone that has seen Harry Potter and the Philosopher's Stone, you probably know when they go to that chamber where we've got all of the floating keys. We're doing similar here, but we've got flying golden snitches. So we need to try and get the right snitch to then charge our wand down the bottom here so we can unlock our final chamber. So I've got a couple of questions that I'm going to ask you, and we'll see if we can try and locate the right snitch with the right answer. So the first question is, what is the name of that valve that manages the flow out of the left atrium? Oh, trying to get it a little bit more in sync. Any ideas? What is that valve that's managing that flow of blood between the left atrium and the next chamber? Looking at those answers that we've got on our golden snitch. Awesome. Got 3 for mitral there. Let's have a look. Look at that. Charges up our wand. Fantastic. Moving on to our next question now. So is the next chamber that the blood goes into going to be small and thin-walled, or is it going to be large and thick-walled? A few different answers there. So yeah, remember we're going from our left atrium, which is our small and thin-walled. We're going to an area that is going to have pretty large and thick-walled, particularly that the next chamber is actually the largest and the thickest within the entire heart. Beautiful. So we've charged up our wand nearly to capacity here. We've got one more question we need to answer. So where does this next chamber, where is that then sending blood to? So once our next chamber fills up with blood, where is that going to be sending blood to? Looking at those answers we've got left. Remember, it's oxygenated blood on this side of the body. Look at that, gold stars to the body. Absolutely, we have our oxygenated blood. We need to send that off to the body to be used for fuel. Fantastic. We've charged up our wand now. Look at that, amazing. We're in our final chamber. We're in the left ventricle now. So within this chamber, this is where we have our oxygenated blood that we're pumping, as we said, to the body to be used for fuel. It does have, as I mentioned, the thickest muscle walls of the entire chambers due to that high pressure of systemic circulation. We have our Purkinje fibers within this chamber as well. So remember that they're those conducting fibers that quickly transmit our electrical impulses. So it makes that rapid and synchronized ventricular contraction. Now, in terms of our diseases or common clinical signs that we'll see associated with the left ventricle, one that we've probably heard of before, DCM or dilated cardiomyopathy. So that's essentially poor contraction of that left ventricle. In terms of the signs that we'll see, you could actually palpate that with a weak pulse. So if you're feeling your, say, your femoral pulse, and you might notice that it's quite weak or thready, that could be a sign that we've got DCM. We also have things like lethargy, collapse, similarly associated to other cardiac clinical signs there. Pulmonary edema again, so we have fluid within the lungs, coughing. What we'll see on an ECG is ventricular arrhythmias. So we'll have quite a wide QRS complex that you can see on an ECG trace. We also have HCM, so our hypertrophic cardiomyopathy. So this is that abnormal thickening of the ventricular walls. See this mainly in cats. It can occur in dogs, but it is primarily seen in cats. And the signs for that are things like sudden collapse, open mouth breathing, which we do know is quite concerning in cats, and even thromboembolism as well. So think about those fate cats. Maria's just asked, can you please repeat what DCM means? Yes, dilated cardiomyopathy.
Okay, thanks.
No worries. We also see left ventricular failure. So this is where our ventricle's not doing its job. We might see pulmonary congestion, coughing, exercise intolerance again, and causes of this can be things like chronic hypertension, so chronic high blood pressure. We're going to see the left ventricle really struggling with that, and our mitral valve disease, which we talked about before, associated with that left atrium. So to recap there, the path of oxygenated blood. So remembering that it's coming from the lungs via the pulmonary vein. It's then going into the left atrium where it's sitting at that next gateway of the mitral valve. As long as that valve is not faulty, it's doing its job with that one-way flow, it's going to allow blood to go into the left ventricle. Once the essentially with the ventricles as well, when the ventricle relaxes, that's when the valve above them, so either the tricuspid or the mitral valve, will open to allow that blood to come through. When the ventricles contract, this is where we have that one-way flow or that one-way gateway. I like to think about it in, if you ever go to the zoo and you're going to the aviary area and you've got two doors and you have to make sure the doors close behind you before you enter into the next one, similar with your valves here. So if we're looking at, say, our left side here, when that left ventricle contracts, the mitral valve will close, and that's when the aortic valve will then open. We've then got more pressure within that ventricle because it's pushing blood out of the heart. So it's going to push blood from the aortic valve into the aorta, where it will then go to the body and diffuse the oxygen among the cells and the tissues there. Just an extra little bit of information here when we're talking about blood pressure. So we often hear the terms diastolic and systolic. So when we look at how that works with the heart, diastole refers to the filling of the chambers and systole refers to the pumping of the chambers. So you can sort of see that a little bit in the image here with the flow that we have through the heart. As we mentioned, we have that tricuspid and mitral valve are only going to be opening when that ventricle is relaxing. So that's when we're going to be filling there. That's our diastole. And then when our ventricle contracts, then we've got our mitral and tricuspid valve are closing. Our pulmonary and aortic valve are opening. The ventricle's contracting. We're going to be pumping blood out of the body there. So just to recap there, have a look at how this blood is moving through the heart there. We're receiving our deoxygenated blood from the cranial or superior vena cava and the inferior or caudal vena cava. Deoxygenated blood into the right atrium. We're sitting at our gateway at that tricuspid valve before we go through to the right ventricle. Once that right ventricle contracts, we're opening up our pulmonary valve. We're moving out via the pulmonary artery. We go to the lungs, we have gas exchange, we dump off our carbon dioxide, we receive our oxygen. Our blood is then coming back via the pulmonary veins. It's going to enter our left atrium, sit at that gateway, that mitral valve, before we go into the left ventricle. Our left ventricle contracts. It's going to push through that aortic valve into the aorta, out to the rest of the body. So let's see how much we've taken on board there. Time for a little pop quiz. Let's see if we can drag and drop and get all of these points correct. So looking at the screen here, I'm going to pop in whatever answers we think are correct. So looking at our image here, again, we have it anatomically reversed, thinking about your blue versus your red, your deoxygenated versus your oxygenated. We'll try and work around in a bit of a clockwise motion, but you might find the arrows are in some confusing little areas. So let's start on our left side here. So first of all, where this first arrow is, looking at the list of different systemic areas on the right-hand side, what do we think is on that first top left box? Got a couple of answers coming in. So we've got quite a few votes for superior vena cava. Let's have a look. We'll drag and drop, and beautiful, correct, fantastic. So if we work our way through, remember that anti-clockwise motion. So think about where the blood goes through next. So we're receiving blood from that cranial part of the body, the superior vena cava. Where else do we get our deoxygenated blood from? Inferior, beautiful. So our inferior vena cava, we can see down the bottom here because it's receiving from the caudal part of the body. So where does that blood next go, that deoxygenated blood? So remember, we've got our deoxygenated blood. So it hasn't been diffused across the capillaries yet, only goes on one side. Yeah, beautiful. Yeah, so we've got quite a few for the right atrium. Let's move that over to our section here. Fantastic. What separates the right atrium and the right ventricle? Lovely. Tricuspid valve, absolutely. So we've got our little valve in here. And after our tricuspid valve, it's going to open up for us when something relaxes. Lovely, right ventricle, absolutely. Fantastic. So once our right ventricle is filled up full of blood, it's going to contract. It's going to close that tricuspid valve. And then where's the next gateway? We can see it's a bit of an arrow here. It's our next gateway. Look at this, gold stars, everyone. Fantastic. Pulmonary valve. Excellent. And then it's going to go into an artery that's going to send it through to the lungs. What's the name of that artery? Lovely. Pulmonary artery. Perfect. So our blood has left the heart. It's now been oxygenated by the lungs. It's going to come back to the heart. What's the first structure that's going to receive it? So remember, being an atrium, can only receive it from a particular structure. Pulmonary veins, beautiful. Now we can see we've got ones on either side here. So we have our left pulmonary veins and we have our right pulmonary veins. Once we've received our oxygenated blood, it's going to go into the left atrium. Lovely. It's then going to stop at the gateway of mitral valve. Fabulous. Look at you all go. Amazing. Once the chamber below relaxes, the mitral valve's going to open, blood's going to go into the, look at you, you're all jumping ahead of me now. Look at that, left ventricle, fantastic. And then finally, it's going to go to the final gateway where we're going to have the largest amount of pressure to push out through the aortic valve into the aorta. Fabulous. And then we go to the body where we're going to use that oxygen for fuel. Amazing. So congratulations, we've just unlocked the chamber of secrets. We've gotten our whole way through the heart. We've unlocked all of our chambers. Our body is now filled full of oxygen. What is your prize? Drum roll. Revelio. You get 1 AVNAT point and a magical understanding of the cardiovascular labyrinth. I'm sorry I'm not there to individually give you all chocolates and lollies and all sorts of goodies, but hopefully the knowledge was enough to kind of take on board there. So as you can see, it's a bit of a complex structure, the heart. There's definitely a lot involved in terms of the different cells, the diseases associated with each of the different chambers, but hopefully our sorting hat and Harry Potter style kind of helped us get through it, understand how each of those different chambers work. That takes us to the end of our presentation this evening. Does anyone have any questions, concerns, feedback, anything about what we've talked about this evening? Thank you, Lisa. I'm glad you enjoyed it. Oh, lovely feedback. Thanks, everyone. Is Voldemort coming soon? Oh, I've just said it out loud. I'm not meant to do that. Well, I'm hoping now that we've, fixed the heart, we've solved the Chamber of Secrets. That should be it, right? That's all the Horcruxes gotten rid of. Thanks, Leanne. Amazing. Thank you so much, everyone, for attending. You shall not be named. I love that. We're hopefully going to adopt this into one of our rolling sessions as well, so it can start to become regular basis. So if you're ever needing a refresher, you can absolutely be popping on and checking out those sessions. But thank you for tuning in for our first cardiac series for this month. We've got some other amazing webinars coming up. So please make sure you keep an eye on our Zoom events. As I said, for students, they're all free. And we've got some really great external speakers, like excellent knowledge level. I'm talking specialist level. So really good to jump into any of those that you can. But as always, any questions, let us know. If there's any particular things that you'd like to see or put in an expression of interest, you're welcome to do so. Hope you'll have a lovely evening. Thank you so much for attending, and I'll see you next time.